We often assume that if we feel physically fine today, our bodies are healthy. But the absence of pain doesn't mean the absence of disease. For decades, traditional medicine separated your body into distinct blocks. You would see a cardiologist for your heart, a nephrologist for your kidneys, and an endocrinologist for your metabolism. The American Heart Association's 2026 guidelines scrap that model entirely. They mandate treating these three major systems as one highly connected web, officially known as CKM syndrome. Waiting for outward physical symptoms to appear allows microscopic damage to compound silently across your blood vessels. By the time you finally experience chest pain or severe fatigue, that multi-system damage is already irreversibly in motion. CKM syndrome focuses on the specific relationship between your heart, your kidneys, and your pancreas. This diagram shows a biological domino effect, where a failure in one organ increases the workload on the others. On the left, dropping eGFR accelerates cardiovascular decay. On the right, high fasting glucose damages microvascular beds, triggering the cardiac overload in the center. Identifying these risks early requires digging into your family medical history to uncover genetic predispositions long before any clinical signs show up. That can be a highly uncomfortable conversation to have. Treating an isolated organ fails because the human body operates as a closed, highly reactive ecosystem. To track these risks, CKM syndrome is divided into 4 stages. Reaching the higher stages brings severe risks, like heart failure, kidney failure, and early death. But staging gives us a clear advantage. If we detect issues early and apply the right inputs, clinical organ damage can actually be stopped or completely reversed. This checklist outlines the standard order set to demand from your doctor. At the top, you need lipid panels, glycemia, and blood pressure checked. Moving down, actively request tests for your kidney disease risk, eGFR and UACR. The trade-off here is that you have to advocate for yourself in the clinic. It takes extra time and could mean covering out-of-pocket costs for these specific labs. Accurate staging through these exact tests is the only way to replace comforting ignorance with actionable, life-saving data. These 3 dashboard gauges show the prevent equations used to calculate your 10-year and 30-year risk for cardiovascular events. Hitting a predicted 10-year risk of 20% or higher is the definitive red line, pushing a patient into CKM stage 3. To fight this progression, the mandatory first-line approach is achieving a 5 to 10% reduction in baseline weight and decreasing your waist circumference. This intensive weight management drastically reduces your metabolic risk and physically shifts you back to a lower, safer CKM stage. The severe trade-off is that this demands daily friction. It requires strict discipline and a total restructuring of your habits, rather than relying on a passive, quick-fix pill. Quantifying your objective risk factors forces you to truly confront reality and commit to uncomfortable, highly effective daily changes. For patients currently in CKM stages 2 and 3, lifestyle changes alone may not be enough. Aggressive medical intervention becomes necessary. This graphic illustrates pharmacological interlock. We combine drug classes to protect the kidneys, pancreas, and heart simultaneously. SGLT2 inhibitors act as the foundational center gear, preventing kidney loss. GLP-1 receptor agonists are added on the right, while RASI or NSMRA medications on the left stop explicit kidney loss. Navigating this interdisciplinary approach means managing a complex team of doctors, dealing with potential medication side effects, and facing higher overall healthcare utilization. Doctors no longer prescribe a pill simply to lower a single metric, like glucose. They prescribe a combination to interlock total organ protection. If you are in stage 0 or 1, your required input is maintaining healthy daily habits and getting basic annual screenings. The trade-off is staying perfectly consistent for life without the push of an urgent diagnosis. If you are in stage 2 or 3, you must combine intensive lifestyle changes with targeted cardioprotective pharmacotherapy to achieve a synergistic reduction in major health events. Every patient faces the same final trade-off. You can choose to confront your uncomfortable baseline data today, or you can face irreversible organ failure later. Do not wait for a medical emergency. Demand the full CKM screening panel to break the infinity loop of organ damage before it breaks you.